there, welcome to my webinar. It's called Clearing Up Cosmetic Confusion. I'm Dr. Susan Mathison of Catalyst Medical Center, and I welcome you to this presentation. It gives you kind of a bird's eye view of what you might experience if you were sitting here with me in the office. And sometimes it's nice to do a little bit of research on your own from the comfort of your sofa or easy chair and just check things out. And so that's what I wanted to do in bringing you this webinar. Because I hear people all the time say, I want to be my best self. I want to feel fresh and energetic, but I have no idea where to start. What can I do, Dr. Sue? And so I really think we need to think about our total look, not just an isolated wrinkle or fold. I think sometimes we get so focused on those small flaws we see in ourselves. A tiny little dot on our nose makes us feel like Rudolph the Red-Nosed Reindeer. But really, we see ourselves with a magnifying mirror of 10, and others are actually a lot more forgiving than we are to ourselves. So I wanted to kind of share with you my thoughts and then take you through the options that you have for helping with those imperfections, but also feeling good about your decisions and feeling empowered. So in case you don't know me, my name is Dr. Susan Mathison. I grew up here in Fargo. I moved here when I was 10 years old, and I went to Shanley High School. After that, I kind of traveled the world a bit. I went to college in California, medical school in Dallas, Texas, and I did my residency in Seattle. I came back to Fargo thinking I would reconnect with my family, and I certainly did, but I've also really reconnected with the entire community, and it's been fun to learn and grow back here in the Midwest. I think we have the best patients of all. I really strive to provide compassionate care for patients. We have a listening ear and an approach that we really try to treat people like friends and family. My specialty, as you may know, is otolaryngology, which includes ear, nose, and throat and head and neck surgery, but also I have a major focus on facial plastic surgery. I love the artistry of aesthetic work, and it's just so fun for me to work with people and help them feel more empowered by improving what they see on the outside, because I do think that impacts what they feel on the inside. Our clinic also provides treatment for allergies, sleep disorders. We certainly have an awesome clinical spa, and I'm so proud of all our skincare estheticians. They do a great job and are really knowledgeable about keeping you up with the latest products and procedures. At Catalyst, we're also passionate about wellness. We treat you as a whole person, regardless of whether you're coming in on the medical side or the cosmetic side. We try to have an integrative approach because we know that what goes on the inside definitely affects how you look and how you feel and how you present yourself to the world. So during this webinar, we're going to have a live Q&A. You can actually tweet me, it's Dr. Sue from Fargo, and then use the hashtag CCCWEB, so Clearing Up Cosmetic Confusion on the Web. Once again, CCCWEB. Or you can email us at wecare@catalystmedicalcenter.com, and we'll get your question that way too. And I will try to answer questions kind of in the moment as we go through this webinar. So it's going to be super fun. So what we're going to talk about during this presentation is really what are your best options. I really want to focus on the mindset that we all have beauty. It's kind of within us, and it's about having that kind of confidence and feeling comfortable in your own skin. We'll talk a bit about lifestyle and how it impacts health and beauty. We'll talk about some skincare basics and my favorite acronym called GRASS. You'll find out what that stands for. I'm going to focus a little bit on one of our products that we have here, as well as professional treatments. And then we'll get a bit into facial volume. I think that's really important to consider as our faces change as we age. It's actually more of a loss of volume that affects us. We'll talk about how we might be able to treat that using injectables. We'll talk about some fun stuff like the vampire facelift. Sounds scary, but it's really cool. as well as how to get lovely lips. We'll talk about options for treating sweaty, because that's certainly something that can make us feel less than confident. We'll talk about surgical options, and we'll also talk a little bit about body sculpting, which is kind of a hot topic these days as well. So, we all, as I said, want to be our best selves, and there's so many options. I always think that there's a lot of conflicting opinions too, and so it's no wonder that people are so confused. So, as I said, I really wanted to do this webinar so that you could kind of clear up some confusing thoughts and ideas and really kind of relax and enjoy some information in the comfort of your own home. And then definitely come and see us, and we can chat through what your specific questions are and how we might be able to help you. So thanks again for listening. This is going to be a lot of fun. I really think that there is an actual mindset for beauty. I talked a bit before about how confidence plays a role. And, I really think that, you need to take a look in the mirror and just take some deep breaths and kind of appreciate yourself. Look into your own eyes. Give yourself a deep, genuine smile. It actually influences your brain chemistry and makes you happier. So that's, if you're kind of having a bad day, just smile at a few people, and it really does go a long way. And there's nothing more beautiful than a smiling face. Appreciate your best features and feel grateful. We all have so much to be grateful for, and I think it's always wonderful to start from that place of gratitude. You should definitely think about playing up your best features. I know that sometimes we have some ambivalence about beauty and great self-care because it's an investment in time and money, but your self-image is actually very, very important to your well-being, and we all deserve to feel great about ourselves even when we're not thrilled with the mirror. So you get to make the choice to shine, even if you do have a pimple to cover up or a wrinkle that you're worrying about. I want to touch on lifestyle choices because these actually can make a huge difference. Perhaps some of you have seen the water challenge on social media, where you commit to drinking a gallon of water over the course of a period of time, and you can actually see dramatic improvement in your skin quality by doing that, just making sure that you're well hydrated. For a lot of us, a gallon is a little much, but it'll definitely replenish your tanks, and then hopefully get you more in the habit of doing at least the half gallon that's kind of classically recommended, 8-ounce glasses of water per day. And I definitely think that water is the beverage of choice. Sodas and coffee should really be used in limited quantities, especially sodas. The high fructose corn syrup in the sweetened sodas, and then the artificial sweeteners in diet sodas is just not good for us. So minimize that as much as possible. I also want to focus a little bit on the importance of sleep. Sleep is when you regenerate, when you get those skin cells repaired. And so really prioritizing your sleep can be super important. Most people need 7 to 8 hours of sleep, and there's lots of research that goes to show what an impact it can make on your life. Certainly, people who are chronically sleep deprived have greater chances of obesity, cardiac disease, neurologic disease, have lowered immune function. So sleep is vitally important for a number of reasons. And of course, all of those issues have an impact on your skin and how you look and feel. The next thing I want to focus on is how eating a clean diet can actually help improve your skin. We've long known that a diet that's higher in carbohydrates, especially the kind of junk food carbohydrates, it has proven to be inflammatory for your skin. It increases your risk of acne, and also it can increased the aging changes of your skin. And so focusing on a clean, low glycemic diet actually improves our skin by maintaining collagen health and the vibrance of your skin. Check out supplements that might enhance skin quality, like omega-3 fatty acids. Definitely avoid smoke and other environmental toxins whenever possible, and create beautiful habits that lead to health and happiness. So I wanted to talk a little bit about skincare basics, and we're not just focusing on an isolated wrinkle or fold. We want to kind of get this overall approach to health and beauty, and certainly skincare basics are important to consider. Always start with a clean face, and ideally use a liquid cleanser, not a bar soap, because bar soaps can kind of strip your your protective layer in your skin, and it can be too drying. You can certainly up-level your cleansing regimen with one of my favorites, the Clarisonic cleansing brush, or you can use a little a sponge made of a special kind of sponge called a dew puff, which is really soft but deeply cleansing. I've really enjoyed the one that I got a couple months ago when we got these in. And you also need to make product choices that work for your skin. And I like to use the term grass as an easy way to remember the different categories that can be helpful for your skin. You definitely should combine some products from these categories to create your personal regimen, and we'll go from there. So the G stands for growth factors, and these are proteins that regulate cellular growth, proliferation, and differentiation. So all the good things that help give us healthy, plump skin cells. They actually often have growth factors that are involved, like something called epidermal growth factor. A lot of them will also have antioxidants, cytokines, and other matrix proteins. In doing that, it helps to minimize the appearance of wrinkles and helps improve skin texture and tone. Next off, one of my favorite products, retinol. This product is a derivative of vitamin A, and you might have heard of its more senior cousin, retin A. Retin A is wonderful, but for a lot of people it can be pretty drying and problematic for their skin in terms of redness and flaking. But a lot of people tolerate retinol really well, and this helps enhance your skin texture and diminishes the appearance of wrinkles and skin discolorations. So a great product. The A in grass stands for products with antioxidant properties. Our skin is exposed to damaging free radicals every day, and so products with vitamin C, vitamin E, and other ingredients like green tea extract, ECGC, actually help protect your skin. The first S in grass stands for specialty products, like there's a number of products that help to address specific skin conditions or area of concerns. Perhaps you need an eye cream or a neck smoother or topical peptides which have smoothing effects. The last S in grass, probably the most important, is sun protection. So I'd like you to choose an SPF with broad spectrum sun protection, which includes UVA and UVB. My favorite sunblocks or sunscreens or sun protection are actually physical sunblocks that have zinc and titanium in them. So I'm a big fan of that. Next, I want to touch a little bit on Jane Iredale. I just have always loved this product line. It's a mineral makeup line. It's actually predates Bare Minerals, I believe. And I think it's so awesome for your skin. It has a little bit of zinc and titanium, so actually the foundation provides a really nice bit of sunblock. So I will actually put it over a tinted moisturizer. I use one from Revision, the tinted moisturizer I really like. And then I'll dust a little bit of Jane Iredale powder foundation over, and it's great. They have lots of cool eyeshadows. They have a really great brow kit. Just a little bit about brows. I think it's so important to take good care of your brows, because it really makes for just such a beautiful frame for your eyes. You can really do wonders with eyebrows. You can even look like you've had a little eye lift if you take good care of your brows. Right now, really full, thick brows are all the fashion rage, so it's great to highlight your brows. They have an awesome selection of lip gloss and lipstick, and then really great colors, lasts really long, feels great on your lips. And then all of us at Catalyst love their hydration spray. It kind of can be used, you can spritz it on your face even before you apply foundation, but definitely after. It's a nice setting spray, as well as being really hydrating and nourishing for your skin. Next, I want to touch a bit on professional treatments. There's nothing like the power of touch, I really think, and so treat yourself once in a while. The French women have basically a monthly appointment for a facial. They really understand the power of a little bit of TLC and professional treatments. Facials are definitely for cleansing and relaxation. They stimulate blood flow to your face and help to provide that dewy glow. Kind of working up the spectrum, there's microdermabrasion, which uses either a powder or a diamond encrusted tip that actually really finely lifts off that dead layer and kind of vacuums it off. So it really polishes your skin and stimulates collagen formation in that way. Chemical peels can also be used as a great way of exfoliating. Both the microdermabrasion and the chemical peels serve to exfoliate, and as you know, kind of taking off that top dead layer stimulates cell turnover, and fresher looking skin. Can also help with little sunspots and bits of texture irregularity. We've also fallen in love with our microneedling system, the Skin Pen. It's so awesome. It basically is a way of applying these microscopic little needles, and it makes tiny little openings in your skin. It's basically just enough to stimulate collagen, and we actually use lots of different products to penetrate into the skin. It can really give some amazing results in terms of freshening your skin, helping with fine lines, and improves pore size and skin texture. Kind of going up a notch even from there, there's our laser and light-based treatments. Most people have heard about laser hair reduction. It's a great system. People do their little mini mustaches. They do chins, sideburns. Yes, even us ladies can get sideburns sometimes. Of course, underarm removal is super popular, and as well as bikini lines and legs. For guys, we do a lot of hair removal on the chest and the back for a smoother look. And for those who don't really want to go the laser route, we do a lot of waxing as well. Our estheticians are awesome at waxing. Some of the other laser treatments that we do the fractional laser, which is great for fine lines and wrinkles. Probably a little bit more intense than the microneedling that I talked about a few minutes ago. We use it a lot for acne scars, and definitely can give a little bit of a lift too. Kind of up a notch even from there is thermage, which we've actually been using for, probably like 13 years. It's really stood the test of time. They've upgraded the system over the years. to minimize pain as much as possible. It definitely does some deep heating of your collagen layer and serves to lift, tighten, and smooth. We've had some patients who do this procedure every 2 years and really appreciate the lifting and tightening and smoothing effect of thermage. Next, I want to talk about facial volume, and there's a video that I'll reference I'll reference for you that really helps you understand this approach. But really, I think we've done ourselves a disservice when we focus on just the parentheses around the mouth, or isolated wrinkles. Really, what happens is we lose volume in our faces, and a lot of that happens through the cheeks. We lose kind of the nice subcutaneous fat layer over our cheekbones, and when we lose this support, the medial part, the fatty part of our cheek, kind of sags down, and we create this fold running from our nose to our lips. So we're able to build that up with fillers. We also can help soften what we call the tear troughs, the little shadows that kind of go underneath our eyes, especially toward our nose. Sometimes it's almost like a little shelf, and we can use filler to bring up the valley of that, the floor of that valley, and minimize the shadow. And although we can't completely correct it, it really makes people look less tired and really improves things. Of course, as we talked about those nasolabial folds, we don't want to focus on them first, but if there's a little additional volume that we need in that area, we can definitely add some volume to make that smooth out. We can add filler to the corners of the mouth to give a happier look. We can also add some volume on either side of the chin. We know as we age, we actually lose bone and soft tissue, and that makes our chins look longer. So if we fill that out, we give back that beautiful oval shape to the face. A lot of the times that we actually use injectables to help us sculpt and refine our looks. I'm actually going to jump to the fillers first. As I mentioned, we use filler to soften creases and fill in and actually add structure. I'm using a lot of Voluma to add that volume to the cheeks and kind of provide some structural support. And then also, sometimes I'll use a little bit of Radius, but I'm using more and more Sculptra as well, which is kind of really can have some nice collagen remodeling effects underneath the skin. Also can help with acne scars. Just a nice product. You do have to do a little work. You have to do some massage and kind of keep that collagen stimulation going. But Sculptra has been a great addition to our options. And then in terms of other fillers, you've probably heard of Juvederm and Restylane. I use a lot of those around the lips, nasolabial folds, filling in the other lines. I use Restylane usually in the tear trough area to fill up that little valley like we chatted about. And then there's things like Botox, Xeomin, and Dysport. Now these are all about relaxing dynamic lines. So Botox and filler are definitely very different animals. My favorite is Botox, but we use the others in specific situations as well. Probably the most famous area to use these products is between the eyebrows. Those little 11s that you can get between your eyebrows, and people look at you and they think you're mad or crabby or what have you. But really it's just there's two kind of diagonal lines that come in, bring your brows together, and then there's an up and down muscle called the procerus muscle. And so those are the things that make you look like you're scowling when you might be just concentrating or focusing on something. But I remember one of my first patients in my practice was actually an older gentleman. He was in his late 60s, and he was the foreman of a construction crew. And he got Botox so that he wouldn't look angry to his men. Certainly, those of us who are moms also get that comment from our kids like, "Mom, what are you mad about?" So it's nice to have something that minimizes that negative expression and conveys more of how we feel on the inside. Next, I want to talk about something super exciting, platelet-rich plasma therapy. I've used stem cells for a long time when I've done fat injections, and I still do some fat injections to rejuvenate the face, but I'm excited about PRP therapy as an even easier way to use stem cells. So basically what we do is we harvest, not really harvest, we draw your blood. Now, we need a fair amount of volume. It's kind of like if you were donating blood, but we're able to spin this down in really the state-of-the-art process. It's all this neat little machine that processes the blood and separates out the platelet-rich plasma. And then we usually will use filler underneath, but then we'll add some platelet-rich plasma through injection, and then we can also apply it topically, especially when we've done something like the skin pen or the fractional, and it will be able to penetrate. And oh my goodness, it's just pretty amazing what it can do in terms of rejuvenating the tissues in your face. It's really quite impressive. So basically, the vampire facelift is when we use it as an injectable, and the vampire facial is when we apply it topically to improve the skin texture and tone. You've probably seen Kim Kardashian on TV with goop on her face. She actually had a vampire facial. Thank goodness life doesn't have to be as dramatic as Kim Kardashian, but right here in our area, we can still do some of those state-of-the-art procedures. So pretty exciting, and definitely something that's been fun for us to work on. It's also an option that can be used for hair loss, and so if you're concerned about thinning hair, whether you're male or female, platelet-rich plasma is an option. I want to talk a little bit about lips as well. Lips are, ever since the First Wives Club, filler in your lips has kind of gotten a bad name, and certainly we see some folks who, definitely use quite a bit of filler in their lips. And so, basically you can still have filler in your lips but look completely natural and beautiful. Adding a little bit of filler adds a little bit of shine to your lips, definitely a lovely shape, minimizes the little wrinkles that go around your lips that your lipstick can bleed into. And I just wanted to show this picture because when you think about it, there's actually some, I call them little pillows or little highlights. In the lower lip, there are two larger ones, and you'll also notice that kind of the proportions of the lips. The lower lip is actually supposed to be a little bit bigger than the upper lip, and usually the ratio is about 3/5 lower lip and about 2/5 upper lip. A lot of people seem to really enlarge that upper lip, perhaps a bit too much, and so that's why we want to be really cautious about giving you that natural look. Basically I will do a little bit of an outline in the outer edge of the lip. We call that the little white roll, and that's what's going to help with those fine lines or the lipstick bleeds. And then I'll strategically place some filler in those little pillows and enhance the shape. The other thing that I want to mention is that little Cupid's bow, and then there's two little columns that run down from your nose to the top of the Cupid's bow, and that's called the philtral columns. And so sometimes I'll run a little line of filler from that area up to the nose, and that also enhances the look of the Cupid's bow. The other thing I really like to do is add a little bit of filler in the corner of the mouth. As we age, sometimes our mouths, the corners of our mouth kind of tend to have a little downturn that makes us look sad or tired. And so by adding just a little bit of product there to support the mouth corners, it can look much happier and really lovely. Another thing that we get asked a lot about is issues with overactive sweating. It can be hands, feet, faces, and of course underarms. There's a condition called hyperhidrosis, which is overactive sweat glands, and probably the area that we focus on the most is the underarms. People are really concerned about their clothes and their odor, and then just the embarrassment of having wet underarms. Probably a lot of the politicians you see out stumping the campaign trail have gotten Botox in their underarms and probably their foreheads to minimize sweating. Somebody else points out that somebody else pointed out to me that probably the tennis players now do a little Botox in their forehead so they don't have to wear those little sweatbands through their hair and on their foreheads, because Botox will do the trick. So we actually inject the medication, and we're able to minimize production of the sweat glands for up to 6 to 9 months. As I mentioned, mostly I treat underarms, but I've also treated the palms of the hands, and I've done one patient with the feet, but that's tender in the feet, so I really don't like to do the hands or the feet, and that's absolutely necessary. Sometimes I do refer people for a surgical procedure. Right now, the only regional option for that is actually at the Mayo Clinic. And then there's another option I wanted to talk about called the Mirror Dry. And the Mirror Dry is a system that basically deep heats the sweat glands and shrinks them down so they don't produce nearly as much sweat. We do 1 to 2 treatments of this, and it can be quite effective. We've had a really high satisfaction rate. So once again, keep in mind either Botox or Mirror Dry. Of course, Mirror Dry would be the longer lasting option. Botox would last for 6 to 9 months. So it kind of depends on your interest level and your budget in terms of what would be the best for you. Then going on into surgery, certainly there are things surgically that we can do. And it's definitely a reasonable option for some people. We can do brow lifts, eye lifts, nasal surgery, and face lifts. Can take away extra skin and sagginess and make a really dramatic impact. I don't do many facelifts anymore, just because we've had such nice filler products available, and that really has helped. But I do lots of rhinoplasty, and then I love, probably my favorite surgery is upper lid blepharoplasty. So really, really nice. Taking out that little bit of skin definitely helps with improved ability to see, and of course it looks a lot nicer too. So it's been fun to work with patients on those. I'll get a little bit into body sculpting as well. We've done smart lipo in the past with great success, but now we're moving more into cool sculpting, which you've probably seen a lot of good press about. We also still use thermage for the body as well, in that the radio frequency, the deep heating of thermage can actually subtly shape and smooth, and I think it's the preference when people have a lot of skin contraction to undergo. So sometimes we'll use cool sculpting and thermage in a package procedure as well. We'll do the cool sculpting first, and then some people might opt to get a thermage treatment on top to tighten up the skin. But cool sculpting is basically cryotherapy, and it uses some deep cooling, and this is able to preferentially freeze the fat cells, meaning that fat cells are much more susceptible to cold than our nerve, muscle, and bone cells. And so this deep freezing freezes the fat, and then the cells burst as they heal, and then they're able to be processed and gotten rid of. So cool sculpt basically kind of goes by cycles. There's applicators that are kind of shaped for the specific area that you're treating. I would say that people will often do several sessions at once, or several cycles at once. For example, the tummy that you see on your left, she probably had 4 cycles. On the top, just underneath the rib cage, and then the bottom area, and you can kind of see what she looks like after 8 weeks. Definitely some significant bulk reduction, and then she underwent a second series to sculpt even more, and you can see her final follow-up pictures, which I think are pretty impressive. So we've been having a lot of fun with this new system. It's been keeping our staff busy. And then I wanted to end with, this concept of our integrative approach, this catalyst difference to beauty. And I really focus on blending the art of beauty and the science of medicine in this holistic way to help you live happier, healthier, and more beautiful lives. And our team is always here before and after procedures, and we really focus on giving great customer service. We definitely love our patients, and thankfully a lot of them love us as well. So it's really fun to be of service and to work here. And I really want to thank you for watching this and spending some of your valuable time learning more about what Catalyst offers and how we might be able to help you. So we'd love for you to experience the Catalyst difference. And there's a special code for you. You get $50 off when you spend any $125 on a service. And then there's also 15% skincare products available, 15% off skincare products on the day of your service. And all you have to do is mention this special code when you register and when you sign up for your appointment. But we'd love to see you for a consultation and to help you go through some of the questions that you might have going through this webinar. Certainly, if you can, tweet me at Dr. Sue from Fargo. You can also use the hashtag CCCWEB or send us an email at wecare@catalystmedicalcenter.com. Once again, I'm so grateful for your time and attention to this fun subject, and I hope we've cleared up a little cosmetic confusion for you. And with that, it's Dr. Sue Mathison signing off for today, and thank you again for joining me. Bye.